As we discussed, this rule change will obviously have a big impact on Planned Parenthood. That organization, in addition to offering other healthcare services, does perform abortions. Joining me now is Dr. Leana Wen, the president of Planned Parenthood. Dr. Wen, thank you very much for being here. I'm just curious, you've heard this conversation and you've heard the supporters of this rule change. What is your reaction?
My reaction is that we have to talk about the real impacts of the Title X gag rule and who it will impact, which is 4 million women and families with low income. Title X was intended to serve those who otherwise would have trouble accessing healthcare. It's families with low income, it's people who live in rural areas, it's people who don't have health insurance. And we're talking about breast and cervical cancer screenings, about STI and HIV tests, about preventive care, affordable birth control. And the Title X gag rule would dismantle the safety net program. And the impact is going to be putting women's health care at risk all across the country. For so many of the patients who rely on Title X, we are their only source of health care.
But supporters of this change, the administration, as you heard Ms. Denny just refer to, they believe that if the funding goes to other organizations, that those other organizations will fill the gap and take up those other services that you worry are going to disappear.
But that's just not what the evidence and science show us. We know that when people cannot go to their provider of choice, they delay care or go without care altogether. We saw what happened in Texas when politicians forced Planned Parenthood health centers to close, and 30,000 fewer women got access to health care. In Iowa, when our health centers were forced to close, again because of restrictive laws that politicians passed, we saw that the rates of sexually transmitted infections skyrocketed. This is about people's lives. In this country, we have huge unmet need. And what this Title X gag rule does is to punish those who already face a disproportionate barrier when it comes to healthcare.
If this rule change goes forward and you're required to be financially and physically separate, what would that mean to Planned Parenthood clinics all over the country?
Well, I want to talk about what this means for patients, for people's healthcare, and what it means for patient rights. Because the Title X gag rule also has a gag, which is to prohibit doctors and nurses from telling our patients full and accurate medical information. That compromises the oath that I took when I became a doctor. You can't be telling patients, well, I can't give you referrals, go look at the internet yourself. I mean, that's just not appropriate. It's preventing us. It's having President Trump and the Trump administration telling doctors what we can and cannot tell our patients about their health options. That's why over 100 physician and public health groups oppose this gag rule, including the American Medical Association, the American Nurses Association, and it is something that we as Planned Parenthood will not stand for.
Dr. Wen, if the rule proceeds as planned, though, what might that mean for clinics? I mean, would you simply have to forego that money, or would you go through the process of trying to somehow disentangle your facilities, financially and physically?
Planned Parenthood will not accept gagged funds. We will never force our physicians and nurses to censor themselves. And we would never ask our patients to come to a health center that provides them with incomplete and inaccurate medical information. That's just not who we are. Now, if the Title X gag rule were implemented, we know that fewer health centers would accept these funds. And as a result, it's patients who are going to suffer because patients will not have access to the care that they need. We as Planned Parenthood, though, will fight back through every avenue because it's our promise to our patients that we will be here for you.
All right, Dr. Leana Wen, president of Planned Parenthood, thank you very much.
Thank you.